Hey everybody! Okay, so today's video is going to be about how much stuff I had to do in order to get to this point. So I don't know how much everybody knows about what you have to do before you get braces, but basically your teeth need to be as good as they can be before you can attach appliances to it. So, a little history about my dental history. I hate going to the dentist, and growing up, we did not have very good, if any, insurance. And so, the last time I had gone to the dentist for anything more than I just pinched my finger. For anything more than a cleaning was to get a filling, and that was when I was 14. And then when I got my own dental insurance when I was 18, I went in and got a cleaning and got an assessment of my teeth, and they were in pretty bad shape then. And I was looking at about $10,000 worth of dental work, which scared me from going back to the dentist for a very, very long time, because I just kind of ostriched the situation because I definitely couldn't afford that kind of dental work. I mean, I was 18 years old. So fast forward until recently, like last year. My current company has really good dental insurance, so I decided to finally get some stuff looked at and taken care of because I was having some pain on this side, just a lot of sensitivity to cold and things like that. And that filling from when I was 14 was really starting to wear down. So I finally went to the dentist. It was someone that was referred to me by my boss at the time. And so I went in, got a cleaning, got a full workup, everything, and then again was looking at a lot of dental work. But thankfully, because of the better dental insurance, most of it was going to be covered. So I mean, I still ended up spending close to $1,000 out of pocket because I had to get, I think, like 9 fillings plus a crown, which I opted for the more expensive one, which they use zirconia or something like that, but it lasts a lot longer than the other types of fillings, and I didn't want to have to deal with it again in 5 years, so I opted for the more expensive one because it would last longer. And then I also had to have all of my wisdom teeth taken out, and this was actually one of the things that really prompted me to go back to the dentist, is because basically my wisdom teeth started growing in when I was like 10, and that was 16 years ago. And I would get a lot of pain in my jaw, and like just everything around it would every once in a while just start swelling up. Food would get stuck in there because it was like if this is your back molar and this is your wisdom tooth, it kind of grew in like this, like, so it was half erupted but also slightly impacted, and it had like this flap of gums over it, and that flap would get really irritated and stuff would get caught in there. It's just like really gross. I also have really bad TMJ, which I thought could be caused by the wisdom teeth, and I also get really bad migraines, which again could be because of the wisdom teeth. Turns out it's not, because neither of those two things have gone away since I got my wisdom teeth taken out. And because of lack of oral hygiene and lack of going to the dentist regularly, I had very bad periodontal disease. So over the last year, I've gotten all of that taken care of. So we started with all of my cavities, getting those filled, doing deep cleanings for the perio. I got the crown, and then in February of this year, I had the wisdom teeth on this side taken out, which sucked, but was okay. And then in June, I got the ones on this side taken out, and that, I tell you guys, was an experience. The bottom one came out totally fine, easier than the other two. Mind you, this is just a little disclaimer, I was not asleep for this. Not even under the gas, nothing, and it was terrible. 0 out of 10, do not recommend, if you are getting your wisdom teeth out, just get put under. Go to an oral surgeon, have them put you completely under, have it all taken out at one time, get it over with. It is not worth it. Just do not be awake for this process. It is traumatic, okay? Like, seriously traumatic. The sounds alone will scar you, okay? Now, like I said, the bottom one came out just fine, and he was like, this one's gonna be so much easier than last time. Or so he thought. So then they start to work on the top one, and it did not want to come out. And apparently they got it to come almost completely out, but it was attached to a bunch of soft tissue, and it had actually been growing into like my sinus cavity. So every time, this is verbatim what my dentist said, he could get it to almost completely show, and then it would slingshot back into my face. So at one point he decided to give up on that tooth, and they had to send me for emergency oral surgery. So my dental assistant, Mark, who's a lovely man who helped put on my braces, had to drive me to Glendale, which was like, I don't know, 45 minutes away. So like in his own car, and I'm just sitting there like, what's happening? And so he drives me to Glendale to like my dentist friend's office. They get me in, and he tries to like yank on it, and I swear to God, it felt like he was trying to pull my skull out of this tiny hole, because all of like the numbing had worn off by this time. Like I was already in a ton of pain, and he tries one more time, and I just like, my whole body just starts like convulsing. Like it hurt so bad. I was like seeing stars. And so he was like, this is ridiculous, I can't work like this. And then he just told the lady to go ahead and put me under, because he's like, it's only a 30-second thing, this is a waste of my time. So they took me to another room, they hooked me up to an IV and put me under. Now mind you, right before this I had to like call my sister to come out all the way from Simi Valley, which I don't know if you're familiar with the layout of Los Angeles, but that is not close. But I called her, I was like, I need you to come get me, I'm in Glendale, because I didn't have my car, it was back at my dentist office, and I was just like really emotional at this point, and like having a mental breakdown. So my sister's driving out, I get put under. Apparently it was like 2-minute procedure. He got it out, it was fine, and then my sister came and picked me up, and then I was just in an incredible amount of pain for like several days. It was a 3-day weekend, and I was like, oh, I'll be fine by the time I go back to work. I was not, and I had to take, like, I went in my first day back to work, and I left after like 2 hours, and then the next day I took a half day, and then I was finally like, okay. So it took like 5 days for me to be okay. But I have to say, this might be worse. Only because at least then I could start eating food on one side of my mouth after a couple of days, like 2 or 3 days. I could at least eat on one side of my mouth. And I cannot eat in any part of my mouth right now. So that's just a little brief history of my dental work. Also, I didn't mention, my perio is like completely under control now. My gums used to bleed like every single time I would brush my teeth, and now it's only if like I accidentally get too far down with the floss or something that they ever bleed. And yeah, and so they're nice and healthy, and that was the only way I could get these bad boys on. So if you guys have any questions about my dental work or like my teeth journey, just leave them in the comments. I'm in a really weird mood right now. It's fine. Don't worry about it. Alright, until next time, guys. Bye.